Hey gang, what day is it? It must be Wednesday. Hi, I'm Mark Sweeney from Austin Dental Spa, Chief Dentist and owner of Austin Dental Spa. If this is your first Wisdom Wednesday, we do this on Facebook Live every Wednesday around 5:30ish or thereabouts. And the goal is to try to bring you the latest information in not only dental care, but in overall health care. Because I get all that stuff in dental journals, medical journals, and I'm privy to a lot of information that hadn't quite hit the general public yet. If you've been tuning in, you're already familiar with all this. Sometimes we get a little goofy, but we like to have fun with it, and then I always give a health tip at the end, something that you can use immediately to hopefully make your life a little better. Every month we also have a theme. This month in June, it was Tune In June, and so we tried to help you tune in to your health, to your body, we talked about all kinds of topics. I cannot believe that the month of June is over. This is the last Wednesday in June. July 1st starts on Saturday, so next month we will have yet another theme for July. I can't give in and tell what it is yet. If you have been paying attention to past Wisdom Wednesdays, you also know that we were up for the contest that used to be called the Best of the Best in Austin, Texas, until this year they changed it to Community Choice Awards. I'm not really sure why the local paper did that, but it was still the same thing. It was the best brunch place in town, the best breakfast tacos, the best romantic restaurant, the best bagels, the best cosmetic dental office, and the best dentist. And we were up for both categories, final 5 in each category. And thank you all who voted for me every day and for Austin Dental Spa every day in those 2 categories. The voting ended on Saturday. We will find out in about 6 weeks. I think they get it down to a final 3, and then they have a big banquet in late August or early September and announce the winners. So delayed gratification, but anyway, thank you for putting us in the winner's circle, and we'll look forward to announcing where it goes from there. Who knows? Today we're going to talk about our scientific topic is something that's near and dear to a lot of people's hearts. Do you know somebody with bad breath? Have you ever been around somebody who has noticeably foul odor coming from their mouth? Why? What's the reason for that? Well, there are actually multiple reasons that can be responsible for a bad odor emanating from people's mouths. Sometimes it's temporary because they ate garlic or onions, some other foul tasting stuff. I like garlic and onions, by the way. I just don't eat it at lunchtime when I'm seeing patients that afternoon because it's hard to get rid of that smell. You know that, the temporary kind of smell. We're talking about the odor that's kind of sulfur containing, that is long lasting. We, being in the dental field, we can tell sometimes when somebody walks in the front door that they've got periodontal disease. It has a very distinct smell if you've worked in dental offices. It's not like hold your stomach, run to the bathroom kind of smell, but it is a distinct odor that I really can't describe, but I know it when I smell it. I can be in a movie theater and somebody around me, I'm like, somebody's got gum disease. Somebody needs to go get their teeth cleaned. Now, that's another part of it. What do you do about it? Well, first of all, let's go over the causes. Dry mouths. A lot of dry mouth going on these days because people are taking medications that are to lower their their blood pressure. A lot of chemo agents for cancer patients dry their mouth out because they kill the fast-growing cells like cancer cells. Well, that also wipes out the salivary glands in their mouths, so their mouths get dry because of that. Also is the reason why they lose their hair, because hair and skin are fast-growing cells. So that can be another reason, hopefully temporary, not permanent. Diabetics tend to have a lot of trouble controlling the accumulations in their mouth and the smell out of their mouth. An upper respiratory infection, which has been going on a lot in Austin with that cloud of smoke from the fires in New Mexico apparently hanging over downtown last week, caused a lot of people to have burning eyes and upper respiratory infections. There was a lot of coughing and sneezing going on. So that can do it. And then I've already mentioned an infection of any kind in the head and neck area, food collecting on the tonsils back at the base of the throat, or poor oral hygiene habits are typically the most common and the easiest to get rid of all the causes of bad breath. If your gums bleed when you're brushing your teeth, if you're using a toothpick after you've eaten and it's bloody on the end after you bring it out, it's time to get a cleaning. Those bacteria that accumulate in there to the point where they're making your gums bleed are the anaerobic bacteria that live down under the gum tissue where there's no oxygen, and those are the nasty ones that can eat away at your bone and your gum tissue to a point where you can get loose teeth and actually end up losing teeth if it goes on for too long. And that's the ones that I was talking about, the smell that everyone that's worked in a dental office can identify anytime they get within 5 feet of somebody that's got that particular kind of bacteria going on in your mouth. So what can you do about it? Well, like I was just talking about with oral hygiene, if it's an oral hygiene problem, if it's a bleeding gums, gingivitis, or periodontal disease issue, it's simple. Go to your dental hygienist, get your teeth clean, get things cleaned up a little bit. If it's a dry mouth issue, check with your doctor about the medications that you're on. It may be one of the medications that's causing you to have that dry mouth. 3M makes a great product that somebody in the creative department dropped the ball. They call it 3M Dry Mouth Solution or Dry Mouth Aid. You can get it on Amazon. It's over the counter. The stuff is great. It comes in a little eyedropper kind of bottle that you can take it out. Well, actually, it's a spray now. It's about that big around and about that tall, so it easily fits in a pocket or a purse, and they've turned it into a spray. You spray it onto the back of your tongue or in the back of your throat, and it's got some kind of lipid, which is a nice name for fat, substance in it that stimulates salivary flow and feels like saliva. And it's a great product. 3M has not marketed it at all, but it's out there, called 3M Dry Mouth Solution or Dry Mouth Relief. So that's a good thing to try if you're suffering from dry mouth. Another thing that you can utilize besides getting your teeth clean, having your dentist or your hygienist check you out, is a tongue scraper. These were real popular back in the 80s, 70s, and 80s, and they're not so much now. We used to give them away when they're unfolded. They're about that long, about that wide, and they've got serrations on it like a saw would have, but they typically come in plastic or a rubbery, bendable kind of plastic. I've seen some metal ones. They're not sharp on the little serrated edges. They're just there to scrape your tongue, and what you do is you put them in a little loop so they're out flat, and you put the ends together so that it's in a loop, and you put them on the back of your tongue and pull forward. Because your tongue, if you could look at it under a microscope, it's actually made up of a bunch of little finger-like projections called filiform papillae, and they angle towards the back of your mouth. So putting a tongue scraper in and pulling forward can actually kind of scrape. You can actually do the same thing with your toothbrush, just putting it as far back as you can without gagging yourself, and brushing forward will also clean those filiform papillae and clean your tongue off. Some people, those little hair-like projections that make up their tongue are so long that they can get food packed in there, and bacteria are going to be not too long after that. There are some spices, at least 2 that I know of, that can affect bad breath. Parsley, dried up parsley, just chewing on a little a couple of leaves of parsley, or chopping it up and chewing it up. And ginger has some kind of chemical in it that also can pleasantly affect your breath. And so I know they make breath mints, those Altoids. The problem is some of the original Altoids had sugar in them as well. They actually do make sugar-free Altoids now. So the chemical warfare is another way to attack bad breath. You got to make sure that you're using a mouthwash or a mouth spray that is alcohol-free, because the alcohol will kill the bacteria initially, but then it dries your mouth out and you're right back to where you started from again. So you want to be careful of all that stuff. And, the Mayo Clinic says you can eat for fresh breath. And again, they say avoid garlic and onions, and things with sugar can cause problems, but they didn't really get into what you could eat. I'm saying the ginger, the breath mints, and maybe what was the other one I had? I've lost it now. Anyway, ginger is, the parsley. Yeah. So, those are things that can help with bad breath that are just easy home remedies. And, but a trip to your hygienist or your dentist is always a good idea. So, health tip. Are you a tooth grinder? Do you clench or grind your teeth at night? We've made more night guards in the 3 years since COVID than we made in 20 years prior to that. People were under stress. Some people still are, but most people have kind of chilled out a little bit about that crazy virus. But there was a lot of tooth grinding, tooth clenching, people breaking teeth and chipping teeth. So a night guard is a simple little plastic thing. You can actually order them online or buy them at the big box pharmacy stores, Walmart, Walgreens, CVS. They make generic ones that are about $45-50 that you can boil in water for 2 minutes and then put in your mouth after they cool down, bite them into place, and it customizes the fit. And they actually will last several months in some people. Now, the major heavy grinders, they're not even going to make it a month before you chew through those. You need a dentist to make you a custom fitted one that's thick enough that it'll last for several years. But they've got a flat surface on the bottom. When your lower teeth hit that and roll around, it's like they're on an ice rink instead of an obstacle course. And for a lot of people, that stops them from clenching, grinding. They don't wake up with headaches, and they don't tear their teeth up. So I hope that's a helpful tip for you. We'll see you next week for the first Wisdom Wednesday in the month of July, and I'll introduce the new theme. In the meantime, stay cool out there, and so long from Austin Dental Spa.